I'm Don Moss, Dean of the College of Integrative Medicine and Health Sciences at Saybrook University, and we're going to talk about the Pathways model and its application for cardiovascular disorders. And I'm going to take a moment here. Our time is short, but I think it's important that we begin with a moment of meditative reflection. I'll begin with this quotation from Chinese tradition. The tranquility of the mind regulates the breathing naturally, and in turn, regulated breathing brings on concentration of the mind naturally. So I'm going to invite each of you to get comfortable where you are, taking a comfortable position with your body. And if it's comfortable for you to do so, allow your eyes to close, and now your breathing to slow and become smooth and gentle, breathing in a very relaxed fashion, not deeply. Don't put any effort into the breathing. Simply allow yourself to breathe comfortably in a relaxed fashion. And be aware, allow yourself to become very absorbed with the process of breathing, becoming more and more completely absorbed in the process of breathing. And with each breath you take, experiencing that your body becomes more relaxed, your mind becomes, and you become more aware and orient to this moment in time. And if you're distracted by anything, simply notice what the distraction is, accept it mindfully, and bring your attention back to your breathing, breathing gently, smoothly, in a relaxed fashion, relaxing your body and quieting your mind and opening your heart. And now stretch, and I'll launch into a presentation, but as I said, we have a small group. I hope we can have a couple of minutes for discussion at the end. Over the last decade, I've spent a great deal of time with a colleague, Angel McGrady, developing a framework, a systematic framework for bringing together self-directed behavior with lifestyle changes, the acquisition of skills, the use of community supports. We put out a book on this approach in 2013 called Pathways to Illness, Pathways to Health. And then we put out a second book applying the model to chronic illness in 2018. And now we're in the process of writing a lay book, a book for lay people to guide themselves through this framework. The Pathways principle is to address the entire continuum of health and disease, and especially the role of our own behavior, our well behaviors and our unhealthy behaviors, which shape our overall health. We address where the individual is at this time, assessing the person collaboratively between the practitioner and the patient, identify current levels of health, insufficiency, deficiency, or disease. And then we develop a plan with the patient for self-directed change. I put up this slide simply to remind everyone of the power of lifestyle change and lifestyle medicine. Especially with cardiovascular illness, we know that we can reduce triglycerides, reduce cholesterol, reduce blood pressure, increase myocardial perfusion. Dean Ornish's early research in lifestyle medicine showed that we can actually reopen blocked arteries through reversal of plaque formation. Following the Ornish program, cardiac patients with depressive problems also became less depressed. Now, this next slide shows John Travis's illness-wellness continuum. Mainstream traditional medicine is oriented at the left side of that continuum, eliminating disability, eliminating symptoms, eliminating illness. But the Pathways model and generally integrative care focuses on the entire illness wellness continuum. We're interested, even when the person has a chronic condition, we're interested in teaching greater, educating the person in self-care skills, and bringing them to higher levels of wellness, even if they have a chronic or even terminal disease. We begin with a comprehensive self-assessment, a collaborative self-assessment, usually going between or taking place between a professional such as a health coach, a nurse, a psychologist, or counselor. And that collaborative self-assessment covers problems and strengths in 10 areas: emotions, cognition, physical activity, nutrition, substance abuse, sleep patterns, social and relationship supports, spiritual practices, and illness self-management, and readiness for change. Then we launch into, again, a dialogue between the practitioner and the patient, actively engaging the patient in setting goals at level 1, level 2, and level 3. Well, level 1 is self-directed behavior change, lifestyle change, increasing activity, enhancing sleep, self-guided nutritional changes, small changes that make a difference. Level 2 is focused on acquiring new skills, learning a relaxation skill or a meditation skill, or learning more about nutrition, using educational resources, handouts, recommended books, using community-based supports and classes. Whoops, I skipped level 3. Level 3 involves professionally delivered treatment. For example, functional medicine evaluation, psychotherapy, biofeedback, neurofeedback, hypnosis, spiritual counseling, therapeutic massage, just a variety of professionally delivered treatments, but continuing the self-directed practices at the same time. This is a kind of a coaching process. We create an alliance with the patient, between the professional and the patient, and then we facilitate the patient's self-engagement in actively managing their own health. Now, this is called illness self-management. It's also called wellness self-management. The patient's needs get identified through a dialogal assessment process. And in other words, we talk about them until the patient feels ready to set a goal. It's not enough for the professional to recommend a goal. The patient has to own that goal herself or himself in order for it to be implemented. We also need to match the person's current level of readiness, motivation, and resources to the goals. So to recommend a completely expensive functional medicine evaluation for a person who doesn't have the insurance or the finances to do so would not be appropriate. So we have to either find an access for that person with limited means to obtain the evaluation, or we have to choose a different goal. We pay attention to the current readiness for change. I refer here to Prochaska. I won't go through the details, but Prochaska has identified strategies for assessing where is the person today. Are they prepared to begin change, or are they still back at the point we call pre-contemplation, where they're not even thinking about it? So level 1 interventions might be something like mindful breathing. I personally hope I can lead the person to mindful breathing because it's such a powerful tool. Nutrition and feeding behavior, making self-directed small changes, sleep and rest, developing more adaptive sleep habits and using sleep hygiene, simple movement, walking short distances. Level 1 nutrition might not be functional nutrition. It might be rather simply eating more mindfully, attention to the beauty of food, choosing to put together foods that are attractive, experiencing pleasure in food or pleasure in cooking, and food as comfort. We also look at forms of self-soothing, rocking, praying, quieting strategies, relaxation. And then moving to level 2, learning skills, progressive muscle relaxation. Now moving from just movement to exercise, participating perhaps in a YMCA gentle yoga class, or a gentle exercise class, attending a meditation class, taking mindfulness training in town or through educational resources such as Jon Kabat-Zinn's CD. Many communities have gentle yoga classes, Tai Chi, Qigong, and other forms of Eastern activity-oriented practices. Level 3, clinical hypnosis, applied psychophysiology, which includes biofeedback and advanced relaxation. I highlighted functional medicine and nutrition because of the conference we're in here today, the Mensa Medical Orientation. I oversee a department within my college of integrative and functional nutrition with a master's degree and a PhD in integrative and functional nutrition, and that is one of our orientations for change. Other level 3 interventions, psychotherapy, guided imagery, medical management, including medication, acupuncture, energy medicine, physical therapy, spiritual counseling. But my time will run out if I don't move into the case narrative. So let me do that. I'm going to give you an example of an individual living with cardiovascular disease, and then talk about the choices she made to create a self-directed program. So first of all, I think we all recognize cardiovascular disorders are all too common. They're the most common chronic disease. They cause substantial distress, disability, and death. Frequently, individuals are anxious and depressed, and there's a vicious cycle between cardiovascular disease and anxiety. Cardiovascular diseases trigger anxiety in people who previously weren't anxious, but anxiety also aggravates cardiovascular condition. It hinders effective treatment when I'm anxious or depressed about my problem, and it further undermines my quality of life. If I can live with a chronic cardiovascular condition, but my days are full of joy, there's a much higher quality of life than if my days are full of anxiety, depression, and worry. Lifestyle factors are major contributors to cardiovascular disease, especially sedentary lifestyle, poor nutrition, and overweight. Psychosocial stress is also a major contributor. David Sagner said, changes in lifestyle could prevent 81% of heart attacks, 81%. Moderating negative lifestyle factors can improve the prognosis for future cardiovascular disease and can moderate current cardiovascular disease. I mentioned Dean Ornish's research earlier. Lifestyle changes, including stress management, nutrition, exercise, diet, and meditation, can substantially improve cardiovascular condition. And now a case narrative. Zhao Qing was an Asian American teacher's aide, married, with a family history of heart disease. She experienced, as is so typical for so many people, a gradual elevation over the decades of her blood pressure, especially in her early 40s, with typical readings at 140/95, over 95 rather. Initially, she just dismissed it and said it's just work stress, because when she was on summer vacation, her blood pressure normalized. But over time, her blood pressure levels became more chronic and higher, reaching 155/95, and she no longer experienced normal pressures in summer. Her primary care doctor recommended weight loss, healthier diet, but her weight increased and she became increasingly reliant on fast food and packaged food. Her physician prescribed a diuretic, and that brought the blood pressure down slightly, but not enough. Her blood pressure continued to range between 148/85 and 150/90, which is dangerous. At age 49, she had a heart attack. Now, the heart attack caused only fairly minor damage to the heart, but this really shook her up immensely to have a heart attack at such a young age. The cardiac workup showed no fully occluded arteries, but atherosclerosis buildup, plaque buildup in several arteries. Her cardiologist identified causes being high work stress, as she kind of knew, moderate depression, and he's identified a probable diagnosis of generalized anxiety disorder, which does have a high correlation with heart disease. The cardiologist referred her to a clinical social worker in the health center for treatment of anxiety and depression and for lifestyle change. The cardiologist realized she needed to do more than just feel better. She needed to change her everyday behaviors. The cardiologist also referred her to cardiac rehabilitation, which had a heart-focused exercise program. Her social worker, Nadine, was familiar with the pathways model and began their contact with a full pathways assessment. Now, I wanted to emphasize here, any health professional can help a patient to understand the pathways model and guide the patient through the pathways model. Nurses, health coaches, social workers, health educators, any behavioral health counselor. In the assessment, Chao-Ching self-rated herself very high in spiritual, social relation, and substance areas, rating herself 4 to 5 in those areas. She also rated herself very high, a 5, in readiness for change. She really felt like this heart attack had scared her, and now she was going to implement everything she should have been doing for a decade. She disclosed poor lifestyle patterns in nutrition, physical activity, and rated herself 2 to 3 in those areas. A 0, she gave herself a 0 in illness self-management because she had ignored lifestyle suggestions and she hadn't even taken her medicine very regularly. She also rated herself very low in the 1 to 2 range for emotions and thinking because of her depression and anxiety. And in this process, she also completed some self-rating scales and earned a severe on anxiety on the Zung self-rating anxiety scale, earned a moderate on the Zung self-rating depression scale, and earned a high on perceived stress. And she quickly identified, yes, these are accurate, because she recognized in herself chronic tension, severe upper body muscle tension, and a perpetual emotional jumpiness. She was an anxious person. So we began the pathways model with encouraging her to consider a variety of possibilities for goals. Level 1 includes small self-directed changes. And she chose initially, my favorite, paced, slow breathing. Paced diaphragmatic breathing is an effective tool to diminish emotional tension, relax physiology, and cope with life stress. She also committed to walking about 1/2 mile to her school 3 times a week. Well, when you think about it, why was she driving? But she was driving. So she committed to walking about 1/2 mile to her school. She also committed to preparing her own meals at home to make her nutrition healthier. She had read that people who just prepare their own meals already produce a significant health effect. She also set a goal to improve her food choices for snacks, to eat more fruits and vegetables for snacks instead of candy, chips, and ice cream, which was her usual preference. So I'll say a little bit more about the breathing. The social worker practiced breathing gently, smoothly with Chao-Ching, practiced in the office, and then Chao-Ching committed to 2 times a day at home to practice mindful, slow, paced breathing. This was relaxed, gentle, diaphragmatic breathing, about 6 breaths a minute. She also was encouraged to breathe mindfully, wrapping her awareness around the process of breathing and observing and accepting whatever unfolded. This same exercise of mindful breathing was repeated every time she came to the clinic. So her sessions began that way. She made very good initial progress on level 1. She found that she could calm herself by paced, slow breathing, and she began to practice the slow breathing every day. She walked to and from work after the beginning. She did the 3 times a week as she said she would, but then she increased it to 4 times a week for the first month. She bought fresh fruit and vegetables, cut the vegetables up so they would be there and ready for her for snacks. And she began gathering recipes for healthy home-cooked meals. She said that she felt moderately better in her mood, and she said it felt like I was doing something for my own well-being, and that was a big part of feeling better. So now we were ready for level 2. She committed to continuing the level 1 activities, which were becoming part of her lifestyle. But now she was going to learn additional skills and draw on some resources for positive lifestyle. Her first level 2 goal was stress management training, and this was actually a class taught by her social worker weekly. Chao Jing attended, learned to identify current stressors, recognizing signs when stress was coming on, recognizing physical and emotional changes that could tell her she's in a stressful situation. And she began to use paced breathing and other relaxation strategies whenever she noticed stress. Now, she was aware of Dean Ornish's books on diet, lifestyle, and heart disease. And she and her husband decided that they would jointly commit to a vegetarian diet with high fiber and abundant fruit and vegetables. Her husband was troubled with obesity and hypertension as well. She also used several recipes from her childhood in a Chinese home, rice and vegetable-based dishes, but she and her husband decided to keep one meat-based meal per week because they felt like it would be easier to make the shift to a dominantly vegetarian diet if they also knew they could enjoy meat once a week. The next level 2 activity goal she set was meditation. So her social worker knew a mantra meditation, repeating a phrase or a word repeatedly and focusing one's awareness on that mantra, that repeated word. Chao Jing began meditating daily using the mantra peace as her focus, but then she heard about a mindfulness class that was nearby and attended and preferred that form of meditation. So she began to do a mindfulness meditation instead of the mantra meditation. One of the principles of the Pathways model is that any time a patient finds a new variation that seems more attractive, we want to encourage that for them. Level 2 activity, she also was attending cardiac rehab now. Initially, she had a real resistance to exercise. She said she hated exercise. But as she began to experience benefit from level 1, she made a commitment to attend cardiac rehab twice a week as a level 2 physical activity. Her husband also bought her a Fitbit device to track her steps, and she set daily step goals, initially just 6,000 or 6,500 steps a day. She was encouraged by the combination of level 1 and level 2 activities. She now practiced paced breathing, progressive muscle relaxation almost every day, was able to significantly relax her body when she sensed stress. She was now meditating, mindfulness meditation, 20 minutes, 4 days a week, regularly walking to work and experiencing much more positive mood. With physical exercise at cardiac rehab, she increased her daily steps further. And with her healthier nutrition, she lost 5 pounds and her blood pressure was now significantly reduced. Her only frustration was that her husband was doing all the things she was doing, and he had lost more weight and lowered his blood pressure more than she had. And that's kind of typical. I think lifestyle change brings about physical changes often more slowly in females, but they're still worthwhile. The changes still come. So now she was ready to do a professional delivered therapy in addition to her exercise, her dietary changes, her meditation, breathing. And she chose heart rate variability biofeedback training. Now, this is a relatively new form of biofeedback. Patients use paced, slow breathing to increase the overall variability rate. And there are significant benefits for many medical conditions, as well as for emotional disorders such as depression and anxiety. Biofeedback for hypertension has a fairly high efficacy rating based on published research. Biofeedback for coronary heart disease has a weaker rating, primarily because there aren't enough studies yet to give it a higher rating. But the few studies that are there, many of them are small studies and case studies, and they show possibility, they show promise. So she decided to do heart rate variability biofeedback. Her baseline assessment on the heart rate variability showed that she was producing normally about 11 beats difference from the peak high rate to the lowest rate in her heartbeat as it changed. And there was also an assessment of what breathing rate produced for her the greatest heart rate variability. Now that breathing rate is called her resonance frequency, and it varies from one person to another, but her resonance frequency was 5 breaths a minute. Now, she asked for more mindfulness. She was really enjoying the mindfulness meditation, so she asked for something that would involve mindfulness at level 3, and she agreed to take on a form of psychotherapy called acceptance and commitment therapy, developed by Steve Hayes and others, based on mindful acceptance as a fundamental skill for living. Instead of fighting what's happening in life, there's an emphasis on mindfully accepting whatever unfolds for me. She committed to 8 to 10 sessions of ACT, or acceptance and commitment therapy. Now, her progress. With her previous practice in paced breathing, she very easily mastered the heart rate variability skills. She practiced with biofeedback instruments in her social worker's office, and she practiced breathing at her breathing frequency of 5.0 breaths per minute at home using a breath pacer so she could see how fast she was breathing, which guided her practice. After 8 weeks of practice at home and in the office, she increased the swings in her heart rate from the baseline of 11 to an amount of 24 beats, which is quite a significant increase. She also said that the heart rate variability exercises were giving her a stronger grip on relaxing when she's anxious. She appreciated the mindfulness exercises and the ACT, acceptance and commitment therapy, and she began to use mindful acceptance at home and at work. Now, she also had a breakthrough in her life at this time. She was at school one day dealing with a special needs child in the classroom where she worked. She used her attitude of mindful acceptance with the child, and the child became much more quiet. The child really became calmer. And Xiaojing realized she loves her job. She loves interacting with troubled children. She loves using skills to intervene with the children when problems arise. And yet she'd been telling people for years that she hated her stressful job. She realized the core of her work stress was not the work or the children, but the fact that she worked with a very critical, demeaning, and harsh classroom teacher who put her down regularly, and she'd worked with this same person for 7 years. This was a real insight for her, and she actually negotiated a new assignment to a different teacher starting the following autumn. And just knowing that this change was coming gave her hope and reduced the burden for her of the work stress. So post-treatment evaluation, her Pathways program and the cardiac rehab program that she went through at the same time assisted her to better manage her cardiovascular health and her general wellness. She was significantly more active, walking regularly, with improved nutrition and frequent use of self-care skills. Her use of meditation, breathing, and other quieting skills moderated her response to stress, can have a tremendous impact on cardiovascular health. The heart rate variability biofeedback produced better autonomic nervous system regulation, which is also positive for cardiovascular illness and general wellness. She regularly used mindful acceptance as a tool for stress reduction, and she felt like she wasn't fighting with herself as much. Whenever she felt challenged, she now shifted into acceptance and that reduced her levels of frustration and negative emotion. She repeated the self-rating scales and scored in the normal range on anxiety, which is a nice shift from severe to normal. She shifted to the normal range on depression, down from moderate to normal. And on perceived stress, she shifted from severe to moderate. So significant changes in all three areas. Her was now regularly at 130/75 with occasional lower values. Now that was 130/75 is much less troublesome than 155/90, still not in the healthy range, but much better. Her weight continued to drop slowly. And the last time she had contact with the clinic, she was near the line between overweight and normal range. Her cardiologist recommended she continue her integrative program, including medication, lifestyle changes, and self-care practices. She was proud that much of her health improvement was based on self-care and changes that she had made in her own behavior. I'm trying to watch and allow people to come into from the waiting room here. I think I've let everybody in. And so welcome to the newcomers. I'm wrapping up here. So to summarize, Chao Ching had made a number of changes. She worked with a social worker to discuss the changes and set the goals, but they were her goals, and she was proud that much of her health improvement was based on self-care and changes that she had made in her own behavior. So that sums up my presentation. Why don't you unmute yourselves? And I'd like to interact with you, those who are here.
Thank you so much, Dr. Moss. That was really enlightening and such positive results that she experienced through the program. I'd love to entertain some questions. We have 5 minutes before we need to get back to the main session. So I know if any of the three attendees here have follow-up questions for Dr. Moss, go ahead. You can either unmute yourselves if that works for you. That's probably easiest, especially in such a small group as this, or you can certainly throw your questions into the chat, and I'm happy to field those questions for you to Dr. Moss. So feel free to jump in with any questions you may have.
Okay, I put you on gallery view, so if you show your video, I will see you better.
Yes, hi Doris, I see you there. Feel free to.
Hello, Michelle, Doris, M.
Well, hi there.
So
well, I just appreciate the whole presentation, and this is a lot of what I learned when I was a student at Saybrook. All the steps of the model of doing your own self-care and your own self-evaluation, and then working with the essential ingredients that you have around you in your community, and then going to professional level of intervention or assistance is a great model from.
Well, I'm so happy, not just with our model, but with the increased emphasis among physicians on lifestyle medicine.
Mm-hmm.
If I knew the emphasis, the total emphasis on nutritional changes here at this conference, I would have really tried very hard to drag more of our nutrition students to attend this week because it would have been valuable. So I really want to stay in touch with Mensa and become aware when they're going to offer another program and get more of our functional nutrition students involved.
Yeah, we would love that, Dr. Moss. Mensa Research Institute and Journey's Dream co-host the event, and we do plan on putting together an event next year. So it would be fantastic to collaborate. We're all about, spreading awareness and helping to have access to the information to as many people as possible.
Yeah. I've seen so many positive changes. I mean, not always. I mean, sometimes that people's medical condition isn't going to improve with lifestyle change. But in those cases, oftentimes I see emotional changes and spiritual changes that make life better. Even though you may have something which is very difficult to treat, life can be richer. And that's equally important.
Right, absolutely. We just have 3 minutes left, so I don't know, Michelle.
Oh,
or...
One
Yes,
other thing, Brea,
absolutely.
I put my email in the chat box. And if
Thank you.
anybody wants, I have an article, it's not published yet, it's under review right now. And if anybody wants a copy of that, it summarizes the entire pathways model in a relatively short article.
Mm-hmm.
Wonderful. Yeah,
Yeah.
thank you so much.
That was going to be my question. Like, is there a way we can learn more about this? Is
Yes.
there a particular website?
We don't have a website yet. We're working on that because we're working on the book for the general population, and that will have a website.
Okay.
Right now, I can send you an article. I can also refer you to the 2 books that are published, Pathways to Illness, Pathways to Health. And the second one is Integrative Pathways. And the second one is primarily on chronic illness, but it also includes more emphasis on complementary and integrative therapies and spiritual practices, because so many times we find that people who live with medical illness or emotional disorders have incredible spiritual needs. And when those are addressed, sometimes that's enough difference that greater health. So we put the emphasis in that second book.
My other
Wonderful.
question was, along with cardiovascular, are there other types of illnesses that have really good results?
Oh, yes. In the case of lupus is often a chronic condition. I published in the Integrated Pathways book a case of a lupus patient who literally, her physicians began to question whether she really had lupus because she no longer tested with abnormal blood levels. And the functional medicine was the primary intervention that made the biggest difference in her case.
All right, everybody. Thank you so much. I'm afraid that's the end of our time. Thank you, Dr. Moss.
Thank
have
you,
a
Brea.
wonderful rest of your day. We're going to hop back into the main session room now for the end of our summit.
Great. Take care.
Thank you,
you
Dr.
too.
Moss. That was very interesting.
Good.
Thank
And good to see you, Doris.